Every 6 minutes, someone in the United States dies from a blood clot. Blood clots often strike without warning, causing heart attacks, pulmonary embolisms, and strokes that turn life upside down. But what if I told you that you could dramatically slash your risk simply by adding a few key foods to your regular diet? In this video, you'll discover 7 of the best foods proven by science to keep your blood flowing smoothly. You'll learn the tropical fruit that reduces platelet stickiness by a whopping 19%, a superfood shown to cut stroke risk in half, which also provides relief for arthritis, tips for enhancing antioxidant bioavailability so you get more protection from foods you already eat, as well as medications to be careful with, and other tips to keep your body going strong. Armed with this knowledge, you'll be empowered to protect yourself and your loved ones from the silent killer of blood clots. First up, we have kiwi fruit. This fuzzy fruit contains a unique enzyme called actinidin, which recent studies show is potent for combating blood clots. Laboratory researchers found that actinidin can break down fibrin, the protein that forms the scaffolding of blood clots. By dissolving fibrin, actinidin can destroy existing clots and prevent new ones from forming. Similarly, a human trial by the University of Oslo found that eating 2 or 3 kiwi fruit per day for 28 days reduced platelet aggregation, a key step in clot formation, by 18% compared to controls. The study also found that kiwi fruit lowered blood triglyceride levels by 15%. That said, you probably don't want to eat 3 kiwis each day. It's known to have laxative effects and is often used to deal with constipation. But more importantly, don't overdo it if you're taking blood thinning medication, like warfarin. Since kiwi fruit reduces blood clotting, consuming significant amounts alongside medications that do the same thing can suppress blood clotting too much. So, as always, moderation is key. You may also like to use mashed kiwi as a meat tenderizer. Just as it can break down fibrin proteins in blood clots, it also works wonders in softening tough meat fibers. Next, put a little spice in your life with cayenne pepper. Cayenne pepper contains compounds like capsaicin and salicylates that can help prevent dangerous blood clots from forming. Studies show that capsaicin has antithrombotic effects, meaning it inhibits platelet aggregation and thins the blood, similar to aspirin. You may have heard of deep vein thrombosis, where blood clots form in the legs. One of the most common drivers of deep vein thrombosis is sitting for long periods, such as on flights or at a desk job, causing blood to pool and clot. These clots can break off and travel to the lungs, causing a life-threatening pulmonary thromboembolism. Well, research on mice found that high doses of capsaicin at preventing pulmonary thromboembolism. Likewise, other studies have shown that cayenne extract dampens blood clotting in human blood. Now, of course, we're not suggesting anyone replace medication with cayenne pepper, but these studies show the potential of medicinal spices like cayenne. So you might like to include moderate amounts in your diet. Sprinkle it in soups, on eggs, or even in hot cocoa for a spicy kick. If you're not a fan of hot dishes, we've got another great food that contains salicylates coming up. For most people, cayenne is a safe, natural way to keep blood flowing smoothly. However, be cautious and inform your doctor if you eat a lot of cayenne or take cayenne supplements, especially if you have a bleeding disorder or take blood thinners. In the US alone, 900,000 people suffer deep vein thrombosis each year, including young people who sit for long hours. So get up and move as often as possible, at least once every hour. If you work at a computer, consider using a sit-stand desk. Avoid crossing your legs or sitting in positions that restrict blood flow. And go for a walk or stretch at lunchtime. Next, aloe vera can be a good option for preventing blood clots, but some people should be cautious. Just like cayenne pepper, aloe contains salicylates and has blood thinning effects. Studies demonstrate that aloe significantly increases clotting times, reduces fibrinogen production, and exhibits antiplatelet activity. Beyond its potential for preventing blood clots, aloe has many other benefits. It's commonly used topically for burns, wounds, psoriasis, and other skin conditions, and may help to prevent diabetes, alleviate constipation, and has powerful antimicrobial properties. However, you should be aware of some precautions. Aloe can interact with certain medications, like diabetes drugs, digoxin, and diuretics, and may enhance the effect of blood thinners like warfarin. At the end of this video, we'll discuss other medications that can significantly increase blood clotting risk, so be sure to make note of that. Some people take aloe capsules as a supplement. However, one study suggests avoiding aloe supplements at least 2 weeks before surgery. Again, that's because of its potent blood thinning effect, which can become a problem during surgery when your body needs to create blood clots. So while aloe may help prevent clots in people who are generally healthy, check with your doctor first if you take medications or have a bleeding disorder. Next, make sure you have clove on your spice rack. Clove have been used for centuries in traditional Ayurvedic medicine, the ancient holistic healing system from India. And modern research is now validating what Ayurvedic practitioners have long known about clove's medicinal properties. Clove contains a potent compound called eugenol, which research shows prevents platelet aggregation and rein in out of control blood clotting. Eugenol in clove also acts as a potent antioxidant, relieves pain, and fights infection, as well as combating diabetes and fatty liver disease, two conditions that we should all be aware of because they develop slowly over years and people often don't notice until there's a serious problem. Furthermore, cloves are rich in antioxidants that help maintain collagen levels in the skin, preventing premature aging from UVB sun damage. On that note, if you've watched our other videos, you'll know that regular moderate sun exposure has broad benefits for cardiovascular health. In fact, one Swedish study found that people who get regular sun exposure have a whopping 30% lower risk of blood clots, and the risk increased by 50% in winter. So make sure you're getting regular sun exposure to as much skin as possible. For more on that, you might like to watch our video on the crazy ways sunlight prevents heart attacks. We'll leave a link to that in the description box. But of course, you want to prevent skin damage. So for all the reasons we've discussed, including protective herbs like clove in your diet is a very wise strategy. We've got another daily favourite for skin health later on too. With its warm, sweet and aromatic flavour, clove adds a touch of depth to baking and desserts, savoury meat dishes, curries, stews, and of course, chai tea. Like many super herbs, clove is available in supplement form. However, caution is advised. Clove supplements can interact with diabetes medications and anticoagulant drugs. So as always, talk to your doctor before adding supplements if you take medication. Are you finding this useful? If so, please click the like button and click subscribe to see more videos from us. Now, have you noticed that strong flavours are particularly beneficial? Well, garlic is another superstar. Garlic is one of the most highly studied foods, particularly for preventing cardiovascular disease. A key way garlic reduces blood clots is by lowering levels of thromboxane, a compound that promotes clot formation. One study found that consuming 1 clove of garlic daily for 16 weeks led to an impressive 80% reduction in serum thromboxane. Thromboxane causes platelets to clump together, forming the basis of a clot. By reducing thromboxane levels, garlic helps keep your blood flowing smoothly. But the benefits don't stop there. Garlic has also been shown to lower blood pressure, reduce inflammation, and even slow the progression of certain cancers. And as you probably know, it's a great immunity booster. These effects are largely attributed to garlic's high content of sulfur compounds like allicin. To maximize allicin formation, chop or crush your garlic cloves and let them sit for 10 to 15 minutes before cooking. This allows the enzymatic reaction that forms allicin to fully occur. Raw garlic is particularly beneficial, as heat can deactivate some of garlic's beneficial compounds. So for the ultimate heart-friendly salad dressing, mix raw crushed garlic into olive oil and lemon juice. Bon appetit! Again, be careful with garlic pills, because extremely high doses can interfere with medications, and generally isn't necessary. Next, you might not expect it, but pineapple is a serious superfood. 1 cup of pineapple packs in a whopping 88% of your daily recommended vitamin C, which is crucial for immune health and iron absorption. It also contains 66% of your daily manganese and 11% of your vitamin B6. But here's where it gets really interesting. Pineapple contains a powerful enzyme called bromelain. Studies show that bromelain has fibrinolytic and antithrombotic effects, meaning it breaks down blood clots and prevents new ones from forming. In fact, it reduced platelet clumping by a whopping 19% in one study, with researchers concluding that 2 large-scale tests on heart patients have shown a practically complete elimination of thrombosis. This is a big deal. Furthermore, some healthcare professionals recommended eating pineapple in the months leading up to surgery, because it's known to reduce swelling, bruising, pain, and scarring after surgery. And why do Brazilians eat grilled pineapple with meat? Just like kiwi fruit, bromelain in pineapple aids digestion by breaking down protein molecules in meat, allowing your small intestine to absorb them more easily. As if that wasn't enough, the anti-inflammatory effects of bromelain may provide relief for arthritis sufferers. One study found it to be as effective as common arthritis medicines for easing osteoarthritis pain. And now to crown our number 1 food: tomatoes. Stroke is the second leading cause of death worldwide. But did you know that eating tomatoes can significantly reduce your risk of stroke? A study published in the journal Neurology found that men with the highest levels of lycopene, a powerful antioxidant in tomatoes, had a remarkable 55% lower risk of stroke compared to those with the lowest levels. But the benefits of tomatoes go beyond stroke prevention. The lycopene in tomatoes also helps keep your blood pressure in check and maintains the health of your arteries. Tomatoes are hands down the best dietary source of lycopene. But there's a trick. To get the most lycopene from your tomatoes, it's best to cook them, because the heat increases bioavailability of lycopene. However, lycopene isn't the only superstar nutrient in tomatoes. They're also loaded with vitamin K for bone health, folate for cell function, beta-carotene for your immune system, naringenin to fight inflammation, and chlorogenic acid to protect your heart. Plus, various antioxidants in tomatoes shield your skin from sun damage. So when you get your regular moderate sun exposure, eat tomatoes beforehand. If you're on blood thinners like warfarin, have a chat with your doctor before significantly increasing your tomato intake, because too many tomatoes could interfere. Armed with these 7 secret weapons, you now hold the power to tip the odds in your favour. But your protection plan isn't complete without a few more crucial tips you can't afford to miss. Firstly, be vigilant for signs like swelling, pain, and redness, particularly in the legs. This can indicate deep vein thrombosis, which you need to get onto ASAP. Likewise, sudden breathlessness or chest pain can signal pulmonary embolism, stroke, or heart attack, so call emergency services if you experience these. For women, it's crucial to understand the impact of oral contraceptives and hormone therapy used for menopause. This is especially true for medications containing estrogen, which can significantly elevate clotting risks. Likewise, pregnancy increases risk, so keep the foods we discussed in mind during those times. And of course, lifestyle plays a huge role. We've discussed the dangers of prolonged sitting. Exercise and staying hydrated are key to maintaining healthy blood viscosity. Compression socks and occasionally elevating your legs can promote better circulation. Just check with your doctor before doing these two if you have a heart condition. Smoking skyrockets the risk for blood clots, as well as excess alcohol and certain foods. For more on foods to avoid, watch our video on the 7 worst foods that cause blood clots. We'll leave a link to that in the description, or click the image on screen. If you found this useful, click the like button, and click subscribe for more heart-healthy videos as we release them.